you often find yourself translating for your child because he or she has trouble communicating with others or have certain difficulty with sounds? What is feeding therapy? How will speech language pathologists help you or your child or even your baby? How does teletherapy work for speech therapy? This is Sofia Scarnati, and you're watching Learning Foundations Live. Hi, good morning, everybody. I'm here with Maddie and Christine. Hi, Maddie. Hi, Christine.
Hi, everyone. Good morning.
Thank you so much for joining us today. And today they come from the Speech and Language Center at Stone Oak. And before we get started on all the questions, can you guys tell us a little bit about yourselves and how did you ended up working as speech therapists?
Okay. Well, I'm Maddie, and I am a speech language pathologist and the assistant clinical director for the Speech and Language Center at Stone Oak. And I have been with the company for 10 years now, just over 10 years. I actually have a background in education. So I started as an elementary education teacher and then went on to grad school to pursue my speech therapy and then moved on over to the world of private clinic and have been with the Speech and Language Center being a speech chicks, and I just love it.
And Christine, what about you?
So I'm not actually an SLP or speech language pathologist. Barb always says I just play one on TV. So I have been with the company for 13 years, and I work in the front office, and I do a lot of the scheduling and a lot of the insurance coordination and basically just patient services. So I'm here to help the client, to match them with the right therapist, to help the therapist with their clients and their schedules. So that's what I'm here for. Yeah.
Okay, well, and thank you again for joining us. And
having us.
So I guess the first question that a lot of people have is, what is speech therapy as a whole?
So speech therapy as a whole, the first thing everyone typically thinks about is speech production, being able to produce an S, an L, an R, being able to be understood. And so that is a lot of what speech therapy is, but speech therapy is even more than that. So in speech therapy, we also address language. So we're looking at the expressive language, receptive language, social skills part, how we're interacting with each other, how we're using vocabulary and language to communicate. Speech therapy also addresses voice, which we can work on, hoarseness, quality of voice, sometimes some vocal nodules, things like that. And fluency. Fluency, also known as stuttering, is another area of speech therapy that typically people think about that we do address. One that is not necessarily thought about as much is the feeding aspect that speech therapists do work with, and the oral motor stuff that goes into speech therapy and how that works. So hopefully by the end of today, everyone will have a little bit more understanding of all the different areas that speech therapy does address and what we can do for you.
Yes, of course. So I guess one of the first questions that a lot of people have, so if you're finding that their child is having trouble with certain sounds, basically, what should they do or what should they consider?
So a lot of times if you find yourself as a parent translating for your child to both familiar and unfamiliar listeners, and you feel like you're doing this probably more than 50% of the time, then there may be some underlying issues. So some of those underlying issues are perceiving the sound. So we might not be hearing the sound the exact way that we want to be producing it. So then being able to produce it is another underlying issue there. Also back to that oral motor, we have to be able to have that coordination with our lips and our tongue to be able to produce those sounds as well. So to start out with, if you are having difficulty with understanding your child, I would definitely think about using some tips of slowing down when talking to your child, having them look at your mouth so they can see what your mouth is doing, and kind of do those things at home. And if you're still not seeing any progress, then that might be time to go ahead and call to just, see if an evaluation is appropriate for them.
Okay. And if they have difficulty processing or following those directions, what can they do?
So following directions, at first, I think we naturally just think that maybe our child's not listening to us. They just don't want to do what I'm telling them to do. But again, there could be a little bit more with that language processing with following directions. So another tip is to maybe take a step back and think about how many directions we're giving the child at one time. So it's real easy for us to just, spur out 3-step directions and not even realize it. And that's a lot for some children to process. So if we take it down a step and maybe just give 1 step at a time and see if the process and success is better at that rate. If you're still seeing difficulty with that, using visuals to help following directions, starting with simple routines, daily routines for following directions is a great way to start to see if we're understanding that, and then building on that and building that vocabulary into other multi-step directions. But again, after you're trying these tips of slowing down, adding some visuals, maybe breaking it down into 1 step at a time, then adding 2 steps, still having some difficulty or still feeling in your gut that they're just not listening in a way, that's another way where we can address the processing and the language, because it could just be difficulty hearing all of those steps and keeping them in the right order.
Yeah, and I know you share this little slide with me about the different things that in language you can look out for to notice if they're having a difficulty, right?
Correct. Mm-hmm.
Okay, so using difficulty using words or sentences, basically not following directions with other kids their age. Incorrect pronouns was one that really attracted my attention.
Yes, and that is one that we do get a lot of questions about. So, it is a hierarchy. So again, these are all things that if you see your child doing this one day, I don't want to be, oh my gosh, this is a red flag, this is a concern. Let's take this and observe our child and work with see if that progress does happen. It's not innate. We do have to learn and we do have to teach these things. So the pronouns is definitely one that I get a lot of questions on. They refer to themselves as a third person, or they're not using I or me and she and he and things like that. And that is where it is a note to us that we want to start modeling it. And another key that I like to tell parents is if a child does use the incorrect pronoun, instead of just saying, oh, that's not the right one, that's a boy, we use he, we just model back. You're right, he is lying. And so they start hearing that, and then the child can start picking those up as well. Teaching I and me is very difficult to do. So I usually tell parents, like, hand over hand, take their hand and have them touch themselves, say, I want milk. Because if they're seeing you say, I want milk, then they're just going to start referring to you as I, because it's kind of, it's not as concrete. But pronouns is definitely something that I think a lot of parents get very nervous about, but it is a process. And I think as long as we're working toward those process, again, if we don't see that progress or that development, then we want to, do an evaluation and look a little bit farther into it.
Okay. And what about when we look at social skills in students? So if their child is having trouble communicating with others or just hanging around with others, what can they do?
So a big sign is the child gets frustrated very easily when they're trying to communicate. We definitely kind of take for granted that a child is young and maybe they don't necessarily understand, but they do. So if a child is trying to tell you something and you tell them, I didn't hear you, I didn't understand that, what did you, try it again, they start to feel like I did something wrong, I can't do it. So I become frustrated as a child to communicate. And we don't want that, because then it's going to be a shutdown and then they're not going to try to communicate. And again, there is a hierarchy in communication. So again, this is where I kind of like to tell parents, bring the reason back on myself. So if they say something and I didn't quite understand it, oh, my ears didn't hear that, I'm sorry, I wasn't listening like I should have. Can you repeat that for me? And then we try again. Or we can say things like, my ears are still having a hard time. Can you show me? And then maybe having them use that to show what they're trying to communicate will bring that frustration level down so that they continue to attempt those communication skills. With that, again, if we're translating for a child or we're not understanding, by the time that they're 2, we should, as familiar listeners, should be understanding 50% or more of what they're saying, at the very least. Unfamiliar listeners, of course, are going to have a little bit harder time with that. The 2-year-old is just now learning how to speak. They're just now learning how to use words. And we don't want to stifle that. We want them to keep doing that. We want them to keep using that. So any kind of encouragement we can give them for that. And then we also, having those peer interactions will help with that communication because they learn from others. They learn from other children their size. And I like to say, they're like, if they can do it, I can do it. And so that's kind of where we want to start looking about how that communication works. They understand turn taking and conversation skills at a very young age. And so they want to start participating in that. And so sometimes it starts out very young as babbling and jargon, and you just have conversations with them, even though it's not real words, because you're working for building that communication and having them understand those conversation skills.
Okay. And what about when they have difficulty playing with other children, or they have difficulty playing friends? That also come into the social skills?
Yes, so that would kind of come into our social skills. It can also run into that just language communication skills. Again, if we think back to having difficulty communicating, that will have difficulty when we try playing with others. If the child is not understood in play, they might start becoming very shy or hesitant to play with someone else because they're not understood during play. So modeling that play is very important. With children, and a play is a hierarchy as well. And this is what play is a toddler's job. That is what they are meant to do in the world right now, is to play. And play is so much learning, and it is just so much building communication and language. So they're going to first start playing by themselves, and they're going to be playing on their own. And then you're going to start to see them start to play alongside others. This can either be called like look upon or associative play or alongside play, where they're just kind of next to each other, but not really playing with each other. And this is where we want to start as adults, to start bridging that gap and letting them start playing with each other. Maybe bringing this little, Johnny's little car in with, Susie's Barbie dolls, and let them play together and start modeling that language with them to build that play. If we are noticing that they are not playing, they're not intrigued, or they don't really want to play with others, they like to kind of pull themselves aside, or while they're playing, they're not using language. So a lot of times children will be playing even if they're by themselves, but you're going to be hearing them talking to themselves or talking to their toys or making sounds, and you'll have emotion in their face and pretend play. And if you're not seeing that happen either, then that is something where we would want to, start to model play with them, and also maybe look at an evaluation for their social as well.
Yes, and before we go to the next question, for those people that just joined us, we are watching Demystifying Speech Therapy, Communication and Feeding Issues with Christine and Maddie from the Speech and Language Center at Stone Oak. And if you have any questions, please leave so on the comments, and we'll be right with you. I will add the questions as we are reaching those topics, so please know that I will get to you. Okay, so the next question that we have is about speech therapy. So Angie Corey is asking, his son is 2 years, and he makes all animal sounds, imitates everything. He mouths the words, but the voice doesn't come out. And he's 2 years old. What would you say to him?
So first, I would encourage to continue modeling those sounds with him, and encouraging to say, "Oh, can you say it louder? Can I hear you?" Another thing to do is to play back the way he's playing, but then stop where that sound is supposed to be. So if if you're doing an animal sound and you're trying to say moo, like the cow says, and break and pause, and try to let your son bring in that sound for you. And if you see his lips moving, and that's great, then you can kind of encourage that. I saw your lips moving. Let me hear it a little bit more. Moo. And then they can kind of go that way with it again. And that doesn't have to just be with animal sounds. That can be with any, reading a book, watching TV, leaving that pause for your child to fill in the blank, in a sense. The other thing with toys is a lot of toys have sounds built into them. They If you open the little, farm sets, if you open the door, an animal sound will be made. If you decide to take the batteries out or to turn that off and they no longer make the sound, then the child has to put the sound in there for the play. So it's encouraging them to use that play. So cars that go down racetracks, there's lots of tracks that have great sounds and lights and bells, and they're fun and they're wonderful, but there's a time where I would recommend turning all that off and let the child do it. So while they're playing, they're no longer just being a passive player in it. They're being an active player in it, and they're producing those sounds and they're engaging it.
Okay. And I know we're going to talk a little bit more about when is a good time for speech therapy. So please stay watching and we will get there. The next question that we had is, what is feeding therapy and how does that help?
Yes. So feeding therapy is definitely one of those we get a lot of questions about. And I will first start by saying feeding therapy starts at a very infant. When a baby is born, we automatically start looking at, is the baby latching? Is the baby latching on the bottle or the nipple? And so that is the very beginning of feeding therapy. If there's difficulty with that, that is where a lactation consultants usually come in to help with that, but also feeding therapists can come in and help with that. And that is the basis and foundation. So we want to start there. And then as they continue to grow and their oral motor skills continue to grow, we start to see that feeding progress. So now we're not just latching on the bottle or the nipple, but we're going to start drinking from a cup. We're going to start drinking from a straw. We're going to start using spoons. And if we have coordination difficulty or muscle weakness with our lips or our tongue, all that becomes very difficult. Another thing to think about is that feeding, the muscles that are used for feeding are prerequisite for speech. So if I am swallowing, and a lot of you might even want to try and do this, is to just take a dry swallow and think of where your tongue goes when you swallow. Okay. If your tongue is going forward, then you're pushing the liquid or the bolus out through your teeth, which is why our lips tend to close to stop that. That is not a correct swallow. And a lot of us can get away with doing that, but it makes it difficult down the road. Now, with that being said, I want you to say the sound K in your mouth and go and feel where your tongue goes. Okay? Your tongue is in the back of your mouth there. If you're
let me try it.
It's something to think about, and this is something that's usually pretty eye-opening to people. If I'm swallowing and my tongue is coming forward, then I may have a difficult time producing K because I'm not being able to retract my tongue back for that correct swallow. Okay, so that's how those two kind of go together. And that's just kind of one example of how feeding therapy does work with that. Again, we look at lips. We look at the lips because we need the lip seal on a breast or nipple or spoon or cup or straw. We need the cheeks to help nice and be strong so we don't pocket any food. This is something that you do see kind of in younger kids. And then also as we get older, where we start to lose some of that muscle strength and we're pocketing food. It's not on purpose, typically. We're not just trying to save it for later, but it's because it's there and we don't feel it anymore, or we don't have the tongue coordination to clean out our cheeks to be able to swallow. And that does become a choking hazard because if it's in our cheeks and we don't know it, it can easily get unlodged and then we swallow it without being prepared to swallow for it. As babies, we have fat pads in our cheeks to help that support for breastfeeding and bottle feeding, but those fat pads then start to disappear and our muscles start to take place on that too. So there's a lot involved in feeding and how that does connect into speech and therapy. As you can see, I'm very passionate about that.
Yes, yes. And I do have to say, I didn't know about the feeding aspect of how speech pathologists were also feeding therapists. I just learned this when I first talked to you about the broadcast. And I mean, I'll touch later on this, but I did get my son, who is a 2-year-old, enrolled through the process, and I'll talk a little bit about my experience through the process and him doing speech therapy too. But for those people that are questioning about what are signs that somebody will need feeding therapy, what are some of those signs that you can say, oh, these they need help with?
Okay, so if we're starting very young, again, as an infant, any kind of difficulty with nursing or bottle feeding is typically a sign that we might want to look at a feeding therapist. As we get a little bit older, we start looking about unusually picky about foods. And I want to tell you that it says unusually because as toddlers, they do become picky for foods. This is also a time where toddlers start to show their like and dislike. But if you feel like there's nothing my toddler will eat, it's probably more than just being a toddler picky feeding. Um, Feeding can be very messy. Now, I say this, and to get messy while feeding is good. It's a good experience for us to be able to get the food on our hands and on our lips. But as we start to progress in our skills for chewing and swallowing, we shouldn't see very many messy feeders anymore. Typically, what messy feeding does say to me is that we do have discoordination with our lips and our tongue. Another thing to think about, I talked about that labial seal, that lip seal on the cup and the spoon, but also while we're chewing. You know, we have to have something to keep that food in our mouth. And if we don't have that lip seal or that closure, then the food is going to come out. And then that's where we kind of become messy. And we say they get more on them than in them. Again, as we're learning how to eat, that is very typical, but we want to see that progress and become less messy as we get a little bit older. As we get older and you're into toddler age, or even older, and you kind of think they're still picky, they're just not eating very much, poor weight gain, long feeding times, those are all red flags as well. Limited diets, we refer to things as like the white diet, where we think, oh, my child eats everything, but we stick down to it, or we make a list of it, and we're like, okay, they're eating mashed potatoes, they're eating maybe pancakes, oatmeal, mac and cheese, and they're not necessarily all white, but they all have a very similar texture or consistency to them. And none of those foods require us to chew in order to eat it. So those foods can sit in our mouth and they can kind of dissolve and melt, or we can mush them with our tongue and then we can swallow. So again, on the outside, it may look like we're chewing and eating, but when we start looking at that food inventory, we realize that they're really not eating anything that's involving a chew. We also work with some sensory feeding. So maybe the child can only eat food if it's dipped in ranch, dipped in ketchup, dipped in mustard, mayonnaise, whatever you want to dip it in.
Yeah.
And it's, again, what that is really doing is it's softening our food so that we can eat it and swallow it, so that we don't have to chew it as much. So those are other things that we do look at. Or spicy. We have kids that will only eat spicy foods and they need that extra sensory input for it. Or they will only eat crunchy foods because they need that extra sensory food for it. So this, again, is where feeding therapy, if you're noticing where you kind of look at your foods and you're not seeing a huge variety of textures, colors, tastes, that might be something that might be behavioral or sensory feeding as well, which also can be there because of underlying oral motor skills.
Yeah. So now that we saw the signs for speech therapy and the signs for feeding therapy, what do parents need to do to get an evaluation or assessment, and what does that involve? Like, what does the evaluation do? What happens during the evaluation?
Okay, I'm gonna take this one.
Yes.
Yes.
Okay. So we would start with an intake. So you would call and you would.
Christine, we can hear you really far away.
Okay. So you would call and we would perform an intake. So we would get some basic information about your child and a little bit of history. And at that point, we'd get your insurance information as well. We would then.
Can you hear her, Maddie?
Yeah, Christine, you still seem like you're a little far away. I'm sorry.
Okay. How's this?
You have a beautiful face. We can see it.
Okay.
Yeah.
So we would start with an intake process where we would get some background information. We would also get your insurance at that point. And then we would, on our end, we would call insurance. At that point, we would also email you, the patient or the client, a patient history form. We would need you to complete that because I want a complete overview of your child and what your child's needs are so I can place them with the correct therapist. So if they are having feeding concerns or they are having fluency concerns, I want to be able to put them with the right therapist. I have 23 therapists that work out of the office. All of them have their masters. We do not hire any assistants here in the office, no assistants for therapy or any of it. So I want to be able to make sure I'm placing that child with the right therapist. Our therapists are constantly going to continuing education classes. And we kind of refer ourselves as speech nerds because we love learning about all new techniques about speech and really priding ourselves on that knowledge. So it's very important for our therapists. It just improves our practice. And so they each have a little bit of a passion, of an area of speech that they really enjoy doing. So we really try to nurture that and really complement that. And then if they're feeling like they're a little lack on a certain area, they can always continue their education in that area to promote their skill set, you know.
Mhm.
So I feel like that's why we have the best therapists here in the office, is because we do match you with the right therapist that's going to fit your child's individual need, because every child is individual and their needs are individual. So what they need is, you know, what your child needs, Sophia, may be different than what you need even. So
Yeah.
it's completely, you know, varied. So we want to make sure we're giving you the best experience possible.
Yeah. And now that we talk about the evaluation, and I can tell you, as I said before, after learning a little bit more about speech therapy and how everything that it encompassed, I actually signed up for an evaluation and did the evaluation, and I started my speech therapy. And I mean, they'll have you move your tongue and do oral movements. They'll have you eat a cracker in front of them and then show you have to open your mouth with your cracker like chewed so they can see it. And it's quite interesting. And also for your child, because I did sign up my son, who's a 2-year-old, because he speaks, but he doesn't speak complete words. He misses like the front and the end, and certain sounds he doesn't do. I mean, which everything started lighting up after I heard how those at 2 years old they should be already doing all those sounds. And
Yes.
even though, I mean, I have an educational background of working with students, I was always second guessing myself if I should need a speech therapy or not, and how would a speech pathologist will help me. So I guess the next question is, how do a speech pathologist will help a baby or a toddler work on speech therapy or feeding therapy?
So to start with the babies, with infants, a lot, I mean, obviously an infant is not, we're not going to sit there and look at them and say, okay, stick your tongue out, move it side to side. They're not going to do that just yet. So all of our therapists have gone to a course that's called Beckman. And in Beckman, it's just one of the many oral motor courses out there. Talks about how you can work the muscles. So it's, I mean, your tongue, your lips, your cheeks are muscles. So there's exercises that we provide the family that involve, you know, working with the child's mouth, and it's involuntary to where the child is then getting stimulation to these muscles that strengthens them for it. And those, you know, can carry on all the way through to adults. It's not only for infants, but obviously they work really well with infants, since infants, you know, it is involuntary. As a child gets older and we're looking at toddler age and they're doing speech therapy, and maybe they are for speech therapy for speech, language, and feeding therapy, those oral motor exercises will continue. But like you mentioned, we will also maybe have the child do some moving around the tongue and showing us the cracker. And the reason we are doing that, just so that everyone is aware, is that we are checking to see how you were able to manipulate that cracker, that bolus. Was it scattered? Was it, you know, were you able to break it down appropriately? And so that is why we look at it. And I tell my kiddos, you only do this with Miss Maddie. Don't do it at the dinner table. You know, the last thing I want is something he keeps sticking out his food at dinner. But that is why we're looking at those things. And so we do have those exercises that continue on. And then we also have, you know, some voluntary movements where we do have the child being able to control that, because feeding and speech is a combination of both involuntary and voluntary movements. We have to be able to control, you know, what our muscles are doing. And you know, speech therapy, we do a lot of what we call play therapy. This is where we are using play to build language and to build communication. Every child is different, and every child maybe reacts a little bit differently and responds a little bit differently to different types of approaches. And this again is where it's nice to have a big practice where we have, you know, 20 plus SLPs, and some therapists have, you know, just really have a, special place in their heart for little ones and doing that play therapy, and other therapists, maybe work a little bit better with the older and the drill therapy. And it depends on the client. And so we match it up as best we can. And if it's not working or scheduling changes, then we rearrange it and we reschedule that. We also collaborate really well with each other, so we can give those approaches and share ideas and activities with each other. But that's kind of what speech therapy looks like at that young age, is that play therapy when we're in the clinic, where we're playing on the ground and we're playing with play sets. And it's also parent coaching, where, it doesn't matter if you have a PhD. Sometimes this is not second nature. And so sometimes it's just a matter of, giving that coaching of, this is how I want you to speak to your child. And this is the words I want you to use and the pacing that I want you to use, so that your child's communication can grow. And so that parent coaching does come into play as well, especially with our little ones.
Well, and in cases with adults, like for me, I mean, there's just certain words where I sometimes get stuck, or where sometimes I'm like, just at the beginning of today, like I struggle with speech pathologist to get it out right. And it's not that I don't know the language or that I haven't spoken it since I was a baby. It was just that I get stuck. So that's also if somebody's also looking for resources for themselves, they can look for. And something that you haven't mentioned is that you also work with bilingual.
Yes.
Mm-hmm. So my son speaks both English and Spanish, and his speech pathologist switches back on and off depending on what he says. Because, for example, he'll say good, but he wouldn't say bien as to how he's feeling. So that's something that they also will match up in case you're looking for that too, which I found that was great. So to put you a little bit on the spot, I know we didn't talk about this, but can you show us just like 2 exercises of what people can do with their tongue to do like a little workout and to help them with oral? It'll be fun. I'll do them with you.
All right. Yes. Okay. Let me see that. So one thing. Okay. So this is kind of a little fun thing. Back to the swallow that we did. And you don't have to do this now, but something to think about is to take a sip of, and I'll do it with for you. Take a small sip of water, and what I'm going to do is I'm going to smile and swallow the water. Okay.
I'm like, I don't have water with me.
Okay. So if you, and that's okay, you don't have to do it. It's one of those things where a lot of people get a little bit nervous about doing. I do like doing this. Like I had my husband do this. Friends do this. But typically, if you have any, if you're not doing what we call the correct swallow, where your tongue is going up and back to propel that liquid down into your stomach and your esophagus, then your lips will probably close. You'll have a hard time swallowing while keeping your smile, because you're going to feel the water coming out through your teeth. Okay, so that is one thing that we, for children, sometimes when we're like, why are they doing this? Why are we doing this? And they'll say, well, let's do this. And when they start to swallow and the water starts dribbling out their mouth, that's why we do this. So an exercise that we work on to build that tongue retraction, of course, is we work on what we call a slurp, where we kind of smile and slurp. And you should feel your tongue going back. You should feel the sides of your tongue touching the back of your molars. And then you swallow. Okay, so you're training that tongue back to swallow.
Oh, wow.
Another one to kind of keep training the tongue up and being able to create a good seal is we do what we call the tongue pops. Yep, so we go up, and you're going to look, if you haven't had it released, your frenulum underneath will pop out, and you're going to pop it down. And you'll notice that if you do this, multiple repetitions, you might notice your tongue gets tired and that pop gets quiet. Or you might ask your child to do this and it might be real weak. Okay. So that again has something to do with that strength. And so we do work up to that. Now, when we're swallowing, we're not having our tongue up here and swallowing. No, but what we're doing is we're strengthening that tongue muscle in order to have that elevation that's important for swallowing and chewing. And then also when you think about speech, in making your L's and making your R's, and bringing your tongue up for SHs and CHs, your tongue should be touching that top part of your mouth. So that those tongue pops, something simple that we can, that we do with children to work on that tongue coordination as well. And I know, Sophia, you probably had them where they were moving their tongue side to side.
Yeah, which I failed because I moved my jaw. So,
okay.
Me too.
A big sign is if you are like this,
There we yes.
You remove the jaw. I didn't even know this. So now
Well,
here
that was
you
wonderful to
I'm
share
practicing all the time. Every time I see a mirror, I'm
that.
like, don't move. I got this. So
And what we're looking at that dissociation again. When we're chewing, we have to be able to dissociate our tongue from our teeth and our cheeks. Otherwise, it happens to all of us. You bite your tongue, you bite your cheek, but that's because they were all moving at the same time. You don't want to be chewing your tongue, right? So we want to have that dissociation. So again, we're not producing speech sounds. We're not chewing or swallowing with this motion, but we're building that muscle and that coordination for clearing our cheeks and pocketing, for being able to chew appropriately.
yeah, no, it was an eye opener for me. So to as I said, talk to you about the broadcast because again, it covers so much. And I guess my next question is, when is a good time for somebody to say, you know what, I need speech therapy. I need to go. So, what is like a good standard or I guess list for checklists?
So, I'm going to tell you that my professional opinion is, I earlier the better. If in doubt, get it checked out. That's what our owner, Barbara, always says. If in doubt, get it checked out. You are mom and dad. You're the family. You have that wonderful gut instinct. So if something doesn't feel right to you, then let's get it checked out. And the great thing is that we do work with insurance companies. And so hopefully your insurance plan would help with the cost of that so that it's not a burden financially to you. We think about a lot of times people say, oh, he's only 3. He doesn't need his R's. Oh, he's only 3. It's fine that he can't say his S's or L's. And, we can probably understand him just fine. But what we really want to do is to look at what may be causing that. Why is your child not producing those sounds yet? And is there an underlying oral motor? Because it is human nature for us to compensate. So if I'm going to find out how I can produce the sound the best way I can, but I may not be using it in the correct way. And so that might work for me at 3, but when I'm 30, it may not work for me anymore, or, older, or when I'm 15, because it's become more difficult. And the co-articulation, being able to move from one sound to the other sound. Saying pathologist is not an easy word to say, and a lot of people struggle over it. But it doesn't mean that someone can't say their THs or their Ls or their F or their T, but they're all in that one giant word. And go figure that a speech pathologist has to have a very difficult title, right? But those are things to look at. So I definitely encourage that earlier intervention. The other thing I like to tell parents about that is we do habituate things. So, if I have learned how to maybe produce a certain sound or chew a certain way at 2 and it's not really correct, I'm going to keep doing that until I'm 7. And so by the time I get to 7 and I haven't really corrected my R's or my L's and it's time for speech therapy, we are now retraining our muscles to the correct way. So instead of having 2 years of retraining, we now have probably more on the lines of 5 or 6 years from when we started talking for retraining. So that's another thing to think about. That earlier intervention. Of course, it's never too late to start either. I don't want anyone to think that, oh, I've missed my window. This is just where I'm at. Speech therapy can help at all ages, from infant to adults. So it's never too late. And sometimes we've had things that have changed and that have caused a change in the way we are producing our speech or the way we are chewing and swallowing that maybe we didn't have as a child.
Yeah, no, definitely. And one of the questions that a lot of people come to Learning Foundations and ask us also is, what is the difference between speech therapy and phonological awareness?
Yeah.
I'll let you talk.
Take it.
So it's a difficult thing. Speech therapy, we do work on what we would call phonological processes, which is, I think, a lot of times people get confused with the phonological awareness. Phonological awareness, of course, is going to be addressing that reading component of understanding, decoding, things like that, which we can address indirectly in a way with speech therapy. We're not reading specialists. We are not we're language communication specialists. So they do kind of overlap in a way. And sometimes we've had children who have receive services from us and have received services from Learning Foundations or receive services in the schools, and they do kind of overlap a little bit in that. But what we are really looking at is how the child is producing these sounds.
Right.
Not necessarily how they're hearing them or they're decoding them, unless we're looking at the language aspect of those things. So they sound very similar, phonological awareness and phonological processing. The awareness part is, again, can they hear the rhyming words? Do they understand how they're rhyming? Can they decode CAT, to where we're going to look at, can they produce CAT? If that kind of helps break that down a little bit.
Yes, and as you said, we work together along a lot of the times where students are going to speech therapy and coming to Learning Foundations.
Right.
So if you guys would like to get an assessment, or if you have questions, the website is Stone Speech, and you can always give them a call too to check if your insurance does cover your assessment. Mine, I was grateful, it covered 100%. So you never know how much you're gonna have to spend until you ask. And I mean, checking the insurance, there's no cost, right?
Right. There's no obligation. So even if we go through the whole intake process and you decide at the end it's not a good time for you, I'm going to sit down. I'm going to talk to you on the phone, not in person anymore right now, but we're going to see what some other options are for you for speech therapy. Because if your child needs speech therapy, whether it's with us or if there's something else, other services available out there, we want to make sure that that child is receiving some kind of services if it's available to them. So we never want anyone to feel that.
Yes.
Yeah.
And with that being said, I'm sorry, Sophia, I just kind of want to piggyback on that. A lot of times, again, financial and coverage can be something that we all think about. If your child is receiving services right now through the school system, we can review that evaluation so that you don't necessarily have to go through another evaluation process. It does depend on insurance coverage and what they require, but that is something that we can do, and that does kind of help families out a little bit. Depending on insurance, or if your insurance plan doesn't cover it, we can use that school evaluation for us. And we do work very closely with the school SLPs. Again, schools are focused on that educational aspect of speech therapy and how they are going to progress academically, and we're going to really focus on that medical aspect of it. So we do work together, and there's no problem with children receiving those services.
Well, and as you said
I was going to
before,
say that about early childhood intervention as well, because we do have families that have their child through an ECI program or something like that, and they can still do private speech as well alongside with their school speech. We also offer summer services for those kiddos who maybe during the school year don't want to take advantage. It may be too much, but they don't receive speech therapy services over the summer. So we do offer summer services for those kiddos as well. So it's always a nice option for you to have.
Yeah, so please make sure you call, go to the website, get any information. And if you have any questions for now, please do so in the comments because we will get to those right now. And if you have also questions about your phonological awareness, you can also call us at Learning Foundations.
That's right.
And if we're not the right place, we'll send you to speech.
Because
we want to make sure that you're getting the right service. So we're not going to be doing something that you don't need. And as well in Speech and Language Center, they will basically guide you to make sure that you're getting the right intervention. Okay, so I do have, okay, well, thank you, Linda, for coming in. She said, great information. And then the next question is, can I improve my pronunciation with speech therapy being over 60 years old?
Yes, if that is something that you want, yes, you can definitely do that. We do, obviously, we do have adult clients that we do work with, and that is something that we can definitely address. And it's depending on what it is exactly that you're looking for with pronunciation, we can definitely look at improving that or working toward making that a little bit stronger for you. There's more to it. I want to say, I'm sorry if my answer seems a little vague, but we work with accent reduction. Sometimes, adults may have an underlying what we call a lisp, that tongue protrusion that we can work with, so that that oral motor would come into play too. So short answer, yes. Long answer is we would probably need a little more information on exactly what I do, but yes.
Yes. And as I said before, you can always call. Make sure that you go through the intake process, go through the checklist, and then they'll tell you what is the best route for you and if the insurance will cover it. So, and again, thank you so much for coming, you guys. I had fun.
This is
Even
the
if I
best.
missed
Thank you so
when
much
I
for
showed my
doing
teeth and swallowing. So, but thank you so much for coming. And if you're watching, please let us know if you have any questions. Give us a call. And next week we are going to be talking about nutrition and how does that affect the academic level as well and their behavior, especially nowadays with all the stress and everything. How nutrition can help also uh, to benefit any basically the children. So please join in next week. Oh, we do have a question right here. They said, "Great job, Maddie and Christine." Well,
Oh, thank you, Haley.
yeah. And if you're there, you want to say hi, please say hi. We're
Hi,
happy to say
everyone.
hi. Yeah.
Can I add one thing
Um,
real quick? We talked a little bit about insurance. So we are in network with some insurances. So we're in network with Blue Cross Blue Shield, United Healthcare, and TRICARE. So, if someone has those insurances and they want to, call and find out what the coverage is going to be like, that's a
mhm.
great option. Also, I just wanted to kind of give an overview of kind of what speech therapy it looks like. So normally we would start with an evaluation, and the evaluation would probably last about 90 minutes or so. Sometimes you're thinking, oh, a 2-year-old on Zoom for 90 minutes, but it's not just the child on Zoom. We're doing parent questionnaires. We're giving you, like you said, parent coaching, and that's your conference with our findings and those kind of things as well. But so we would start with an evaluation process, usually unless you had an evaluation report from school. And then we would, based on that information, they would design a treatment plan for therapy for your child. So it would be either like 1 to 2 times a week or 2 to 3 times a week, or just, one time a week, whatever their findings or what their recommendations are, that's what we would let you know. And then we schedule like a soccer practice. So we have 30-minute professional hour sessions, and we schedule like a soccer practice, so it's the same time every week. So if your child is coming Monday, Wednesday at 3:30, it's every Monday and Wednesday at 3:30 with Miss Maddie if they're seeing Miss Maddie. We want to build that relationship with that therapist and that child, because you are doing some silly things like opening your mouth and looking,
Mhm.
when we're in
Yeah.
person, we're actually getting in their mouth. So I mean, we want to build that relationship and that confidence level and all that with the family and also the therapist. So
Yeah.
so that's important to us to maintain that relationship as well. So I just wanted to kind of discuss that aspect of it, kind of what it looks like. Some kids are in therapy longer than others. People will call me and say, well, how long do you think it will take to fix this? Every child is different. Every child responds differently.
Mhm.
Every child has a different motivation level. So it really is just an individual plan that we design for your child. And we're constantly looking at that plan. We may change it a little bit if things are going great, or he's mastered this sound, we may add a different sound or something else. So there's always ongoing speech goals as the kids get a little bit older that we can always work on as well. So I just wanted to kind of address that with you guys and let y'all know that that's the process. But
Yeah.
yeah,
Of course.
we're
And
excited.
we do have one more question for you guys.
Awesome.
Is there a difference between online and on-site services that you can offer
Yeah.
for speech and play therapy?
Very good question, especially in this world right now. So right now we are providing those teletherapy services. The difference that the teletherapy virtual services does look like right now is we are including the parents in those sessions as our, we're parent coaching and as kind of assisting the therapist, since we are not there, obviously. So we work with our clients, and we may say next week we're going to work on a farm. Let's have a farm set. So we'll work with the parent on modeling and having that language interaction with the child as well. Of course, we do things online. We have interaction online. I know screen time has been a huge thing and a huge question that's been coming to everyone's mind. And what I want to say to kind of make, feel a little better about any of it is that interactive screen time, quality screen time is best. So if we're interacting, even though it's through the screen, and we'd love to see you in person, we're still getting that interaction, and we're doing that parent coaching with you in virtual. When we do in-clinic services, of course, we do work toward that independent communication. So we do want the child to be able to do this independently and come to the sessions independently, but that doesn't always work. And in some situations, we do want the parent involved. Again, for that parent coaching. Parents are always involved. I want to kind of pack that up. Parents, it's always a team. But when we're doing virtual learning, the parent, sometimes it's a sibling even. Maybe the child is responding better to a sibling sitting there with them, and they're helping the therapist in a way with those therapy sessions. And then in clinic sessions, they're individual sessions, and as needed or as appropriate and we feel is needed for the child and the family, then a parent will attend to it or observe it, or a sibling to help build that generalization into that natural setting. So we really did our best, and I think we've done a great job at really trying to make them both very efficient and appropriate for the child. Obviously, it's different versus a screen and in person, but they've been very beneficial, and we've seen great progress in both.
Yeah, and something to add to that. I mean, since Lee already started, I can tell you a little bit more. Also, like, they have a background so that they don't see anything behind the therapist, so that there's no distractions. I pretty much put my 2-year-old on a high chair, and with, of course, his buckles. And yesterday, I actually left the area. I mean, I was seeing him from far away and hearing everything that was going on, but he actually was better behaved without me right next to him. And he was participating. I mean, he was getting there. So we're gonna try it that way today again and see how it happens. But I know the sibling thing is a good idea. I maybe put Julie in there and see if she helps her brother too. But and they also dress up. So Doris got dressed up as a pirate, and we're going this way, that way, and everything.
I love it.
And my son was like, "Mom, more!" Like, he just wanted more.
So yes, if your child is one that wants that, dress up and stuff like that, we have the therapist for you.
Yes, we do.
But we don't necessarily dress up for our adult clients, but unless they want to.
I'm like, I wanted to get dressed up.
Everyone's individual, so we will, what works for the client, we will make sure it gets done. So.
Sophia, on that note, when you were talking about in clinic versus telehealth, we when this whole COVID thing started, we're clinic based only normally, and we switched to online all teletherapy practice in 3 days. I mean, that's how long we had to switch. And we were not quite sure how it was going to work out, to be honest with you. We did not know how our clients were going to respond to therapy. We did not know how they would respond to feeding therapy. How's a 2-year-old going to get on to a Zoom meeting? We too had doubts because we didn't really know. I mean, we had talked about it. We had done some little seminars about it, but we were thrust into it. And we have actually had a lot of great responses. And some of our feeding therapy has gone actually better because it's at home in their home setting. They can go to their fridge and get what they need. Their family is right there. It's their kitchen. It's their feeding time. So some of those sensory feedings, it gives them a sense of more of a control of the situation. And then some of our littles have really surprised us as well, because like you said, with the parent coaching and getting the parents involved, and it really helps with that carryover at the home. The home plan is working out better. I mean, I just feel like there's a better sense of community when we are kind of doing some of this telehealth with these littles that maybe we were missing a little bit of that intimacy. I mean, we're in their homes, they're in our homes. I mean, it's you're entrusting us with your most prized possession. So I feel like it's really brought us more on a personal level with some of these families. And I think it's been a good experience for most kids overall. Majority of the kids are doing very well with the telepractice, when we were very impressed and very excited about, because we too weren't sure.
And as Maddie said, it's quality one-on-one time, and so it's not like they're watching TV or they're watching a game. They're actually interacting, and they have a trainer, a speech pathologist, in our case in Learning Foundations, a trainer interacting with them and making sure that everything's basically working and doing the right motions with the face and so on. Yeah.
And it's been funny too. I mean, the kids
it's been great.
Yeah.
We've
had some good stories, so it's fun.
Yeah.
But
so
we're excited, and we are excited to
eventually get back in the clinic, and we're working on those plans eventually. I mean, I get the calls every day, but right now we just have to do what's best and safe for the community, and we'll get there, you know. It's a changing world every day.
We have to work together, as you said. But thank you
Exactly.
again so
Thank
much
you.
for
Thank you.
sharing the information. Yes, and
Yeah.
and if you're out there again, please give us a call. We're here to help either at speech therapy or at Learning Foundations, and we'll help you find the right place for you for the right intervention. And if it's either speech or feeding therapy and doing all the weird movements with your mouth, they'll get you on.
We'll get you.
You have to
Thank
admit
you,
you're having
everybody. And
you.
and again, next Friday we will be talking about nutrition at 10 a.m. So please come and join us and ask any questions you may have. Have a great day. Have a great weekend, everybody. I'll see you
Bye,
next
guys.
Friday.
Thank you.
Bye.